So, good evening. My name is Samsara Morgan, and I am the Executive Director of Oakland Better Birth Foundation in beautiful, sometimes sunny Oakland, California. And this is a portion of our regular Tuesday night Shiphrahs Circle Community Doula Program meeting. We are so excited that we have a wonderful guest, Nneka Hall, who is here to join in our observance around Infant Mortality Awareness Month and the issues that impact that and the healing from that people need to be aware of since it's affecting so many of us. Of course, unfortunately, African American mothers are most stricken with this heartbreak. But as far as being a country, this country is the country that loses the most babies in the industrialized world. So that's deplorable. And we definitely want to share information, strength, and hope for those who have lost their little ones, and information, strength, and hope for those who are currently pregnant, that they may keep their little ones safe and in their care. So I will turn it over to Nneka to introduce herself and share what she would like to with us. Tell us who you are, my friend.
Well, good evening. My name is Nneka Hall. I'm the mom of four, three who are with me, and one who rests in paradise. It's the one who rests in paradise that actually brought me into this work and has given me the fuel, the strength, and the interest actually in maternal health. I am a full spectrum doula here in Massachusetts, maternal health advocate. I sit on the Racial Inequities and Maternal Health Commission here, which is a 99% Black commission. I sit on that's a relatively new commission. That's a temporary commission. But I've sat on the Ellen Story Postpartum Depression Commission for 2 years now. Wow. September was my second year as a commissioner on the PPD commission. So I love that commission a lot. I've spoken at Harvard twice. I've been paid to speak at Harvard twice. I've sat in the room with three presidents, President Obama, President Biden when he was vice president, and the one who got out of office that we won't name right now. And I've had, because of my angel baby Anaya Marie's existence, I've had experiences that seriously I would never have had in my lifetime. And the trickle down effect, I've been able to give people certain experiences because she was here. Just a brief version of what happened. August 26, 2010, I went in for my routine checkup, 39-week checkup, and found that there was no heartbeat. And my life changed almost immediately. August 27th was my 37th birthday. And it's the day that my daughter was born still. So I call that day my rebirth, because as soon as I had to know the whys, and once I learned the whys, I could not believe that everyone was not screaming it from the rooftop about Black maternal mortality and Black infant mortality. The reality is I had preeclampsia that was missed, and had my daughter not died when she did, I wouldn't be here to talk to you, simply because I had been spilling protein from the beginning, trace amount at the beginning of the second trimester, 3+ at the time of Anaya's death. And they were marking each urinalysis as an unclean catch. So and I kept going back saying there's something wrong. Why does she have hiccups the way that she does? Why does it feel like she's scratching to get out of my stomach, etc.? And they said it was all in my head. So she is why I'm here. She is why I do this work. She is why I uplift her voice and all of the angel babies that I come in contact with, that I have come in contact with in the past 11 years. So with that said, may I share my screen? Or we could just talk. It's
Either
up to you
way,
guys. It's up to
have
you guys. I mean,
sharing the screen. Cool.
everyone here, except for two, have seen, have gone through the course. So this is a time that, if you want, you could ask me whatever it is that you want to know and I could answer it. It's up to you guys. This is your time. Hi, little one.
Cutie.
Hi.
I think it would be good for you to share your,
okay.
Yeah. And
All
you're
right, so
screen sharing now.
Okay, let me see. Let me make sure I do this properly. I know Mercury is in retrograde, so okay, let's see. Can you see it? Let me see. Windows, Zoom, edit, file. There's a way to do this. Oh, wait a minute. Okay, I had to click on this. I did it earlier. Give me 1 second. Full screen mode. Yes. Yes. Can you all see that? No. Wait a minute. What happened?
I see it.
Oh, okay, great. Now let me move this a little bit. All right. So this is just a brief introduction to PAIL, pregnancy and infant loss. And we're going to go through this quickly so that I'm being mindful of the time. I'm looking at the time now. I do not want to keep you over your time. So let me.
Our time is 9 o'clock, our time.
Okay.
Much later for you. So it's 7:31 right now. We're cool.
It's 10:31 here. So I'm being mindful and I can talk. So
we want to hear you talk, Fred.
All right, let's go. Let me stop my video because I can't stand to see myself when I'm presenting. Grief never ends, but it changes. It's a passage and not a place to stay. Grief is not a sign of weakness nor a lack of faith. It is the price of love. So here you see me and my little and my not so little. It's time for me to switch that.
I don't think we're seeing anything.
Your presentation isn't moving.
Oh, it's not? Okay, wait a minute. Let me stop share.
Yeah, we're still at the introductory place.
Okay, wait a minute. I've moved on. Wait a minute. I stopped share. Screen share. Go in here. See, this is what I mean about these things. Can you see it now?
Yes.
All right. So once again, a picture of me. This is my beautiful butterfly baby, Anaya Marie, who was born on August 27th, 2010, which was my 37th birthday. And here you see a picture that we took. Geez, that was about 3 years ago. So imagine everyone except for the tall, my only son here being a little bit taller. Just a little bit, not much, but I'm the founder of Quietly United and Lost Together. I'm a full spectrum doula, maternal fetal health advocate, commissioner, public speaker advocate, founder of Mother's Kitchen, founder of Mother is Supreme Inc., and commissioner on the Maternal Equity Commission. Did it move this time? Can you see types of pregnancy and infant loss?
No.
I think it started and then it stopped.
I don't know what's going on with this. Let me just get into the main. I apologize, guys. Let me go back here and get out of here. It's not agreeing with us, well, with me. Let me see if my son's sitting right here because I want you to, oh, okay, thank you. He pressed the button for me. Share. Can you see my screen now?
I can.
Oh, you cannot?
I can.
Okay, so I'm gonna go back. So types of pregnancy and infant loss. Oh, So this is the one that described everyone in
That
them
was the first
pictures.
one. We saw that
Right.
one.
All right. So here we are. Types of pregnancy and infant loss. Can you see this?
Yes.
I'm sorry. I was trying to show full screen. Oh, he's pressing something. Okay. That's a little better. Thank you. So of course we have abortion, miscarriage, stillbirth, fatal diagnosis, infant death, and of course maternal mortality. Can't click like that. Let me go to the next one. Okay. Just for the sake of my courses, abortion is the release of a pregnancy. When you hear the word abortion, you often think of so many derogatory terms and the way that people think of it. And what people don't understand is that when someone suffers a miscarriage, when they have a stillbirth, any kind of intrauterine fetal demise is considered some sort of whatever spontaneous abortion, or when the baby dies in utero and you have to give the DNC, it's still considered an abortion. In some hospitals, they'll only allow a person who has miscarried to have a DNC if their life is compromised, if they're at risk of losing their life. No, that's not working, Jelani. So I'll just press the button here. Types of abortion. Of course, you have the DNC, which is done within the first 12 weeks, the induction, which is 20 weeks and up. And know that when someone releases a pregnancy 20 weeks or greater, it's not because they want to terminate the pregnancy. It's because the child has an illness that's incompatible with life, or their life is at risk. These are the drugs that can be used to release the pregnancy within the first 10 weeks of pregnancy. Of course, there's the herbal, and then I always focus on the soft touch, because the soft touch is the same thing as an MVA, manual vacuum aspiration, which they can do within the comfort of a gynecologist's office. So I know we've all seen protesters out in front of abortion clinics. However, with a soft touch, anyone could be going to see their gynecologist just for a routine checkup, or just something's not feeling right or smelling right, or pH is off, or what have you. And no one would even know, if this was offered and insurance covered it, that they were going to their gynecologist's office to terminate a pregnancy. Why isn't this offered to any and everyone? Well, right now, there are very few doctors in the United States who will do this. There are very few who are trained to do it, and mostly concierge doctors are the ones who offer the soft touch. So who is that mainly for? Not everyone, but one person can unmute. Who's the soft touch mainly for? People who can afford to pay for it. The elitist, the ones who make millions and billions every year, and who can afford to have a doctor come into their home to facilitate the release of a pregnancy. This is something that would change the look of releasing a pregnancy. So a miscarriage is a spontaneous loss of a pregnancy before the 20th week, 24th week, 27th week, depending on your location, often depending on your doctor, depending on the city's law rules, according to this, the hospital's rule. It could be a plethora of when the size of the baby. It could be a plethora of questions surrounding. Someone could think that they have a viable pregnancy, but because of the person who sees them, it's deemed a miscarriage versus a stillbirth. But this occurs often before the 12th week. A stillbirth is a fetal death that occurs after 20 weeks, 24 weeks, 27 weeks, or 28 weeks of pregnancy. And once again, this varies from state to state, country to country, county to county, hospital to hospital, and provider to provider. It also depends on, no matter what the gestational age of the child is, it also depends on the child's size, weight at birth. A fatal diagnosis is a pregnancy in which a baby might die prior to or shortly after birth due to an irreversible illness. Now, I often say, just remember, there was a time when Down syndrome was a fatal diagnosis. It is one of the trisomies. So what that tells us is that not every fatal diagnosis results in the death of a child. Some people are born with a fatal diagnosis, they have a surgery and they're healed. I have one of those, she's 16 now. And some people just are able to live with whatever the diagnosis is. So, sometimes I think they need to change the way that the terminology used around some of these things. So what are the causes of infant deaths? Of course, we are all familiar with prematurity. We're also familiar with sudden infant death syndrome, SIDS. You may or may not be familiar with sudden unexpected infant death syndrome, SUIDS. We're familiar with shaken baby syndrome, and then there are the miscellaneous causes. A premature birth is one that takes place 3 weeks or more before the baby's due date. Sudden infant death syndrome is the unexplained death of an infant, usually during sleep before the first birthday. Sudden unexpected infant death syndrome is the unexpected, unexplained death of an infant before the child's birthday, but it's not sleep related. Shaken baby syndrome is an injury to a baby caused by being shaken violently and repeatedly. Shaking can cause swelling of the brain, internal bleeding, detached retinas leading to blindness, mental retardation, and or death. And of course, we know there are chronic illnesses, there are accidents, there's child abuse, and there are more, just a plethora of other illnesses that can happen. And then there's murder that can cause the death of an infant. An angel wrote in the book of life, my baby's date of birth, then whispered as she closed the book, too beautiful for earth, author unknown. So what does it mean to hold space? And this is one of my favorite quotes ever. The author is Heather Platt. Holding space means to be with someone without judgment, to donate your ears and heart without wanting anything back, to practice empathy and compassion, to accept someone's truth no matter what they are, to allow and accept, embrace with 2 hands instead of pointing 1 finger, to come in neutral, open for them, not for yourself. Holding space means to put your needs and opinions aside and allow someone to just be. So when you're holding space, you always want to follow the birthing person's and the family's lead. You want to work from a place of open ears and a closed mouth. Create an abortion and or miscarriage kit to help the birthing person through this time if they have opted to release the pregnancy naturally or release the pregnancy with the help of a D&C or what have you, or if they're having a miscarriage. Treat the family the same way you would any laboring family. For example, give them the best birth possible, regardless of the outcome. In the instance of a wanted pregnancy, remember, regardless of the outcome, a baby is being born. So keep that in your head in spite of the knowledge that the baby will be born still, or the baby has a fatal diagnosis and might not live long. Give them the best birth possible. Refer the birthing person or family to local and virtual resources. I love working with a therapeutic team, along with postpartum doulas and birth doulas. That surround care model really does shape and form how the grieving family, actually, the grieving dynamic, how it will look, and what they'll develop. Will they develop postpartum depression, anxiety, and PTSD? With the surround care, some of that weight can be taken off of them. Facilitate a ritual of release for yourself in order for you to let go of your grief, because you will grieve along with your clients, as I'm sure you all know. So let's go into reproductive health in the Black woman for a moment. We're going to go through this. Of course, we know that Dr. J. Marion Sims is known as the father of modern gynecology, and he perfected his techniques on enslaved women. Only 3 of the women's names are known, and they are Anarcha, Lucy, and Betsy. So what's morbidity and what's mortality? Morbidity is any health concern attributed to and or aggravated by pregnancy and childbirth that has a negative impact on a woman's well-being. Mortality is simply the condition of being dead. Black women are 2 to 6 times more likely to experience a pregnancy-related death than white women. Now, this varies, once again, from city to city. Oh, let's just put it this way to make it simple, zip code to zip code. Because you can have 2 neighboring cities and just because they live in a zip code that's deemed unsupportable or low income, their care is completely different. Black women has a heightened risk of pregnancy-related deaths that spans income and education level. Black women display signs of preeclampsia earlier in pregnancy than white women. Black women experience physical weathering, which means their bodies age faster due to exposure to chronic stress linked to socioeconomic disadvantage and discrimination over their life course, thus making pregnancy riskier at an earlier age. Black women are 243% more likely to die due to pregnancy-related complications in the United States. So what are the morbidity illnesses? We have hypertensive diseases, obstetric hemorrhage, prolonged and obstructed labor, anemia, postpartum depression, incontinence, obstetric fistula, postpartum vaginal or uterine prolapse. We also have HIV/AIDS and major pregnancy-related complications. Approximately 50,000 to 75,000 deaths worldwide annually are attributed to hypertensive disorders, including preeclampsia, eclampsia, and HELLP syndrome. Up to 60% of hypertension-related maternal deaths are potentially preventable. There continue to be missed opportunities for appropriate recommended care of severe maternal hypertension. Black women have twice the risk than white women for mortality associated with preeclampsia and eclampsia. A Black woman is 33% more likely to die of heart disease. Suicide is the second leading cause of death in postpartum women. African American women are not screened for postpartum depression because of the strong mothers don't suffer from postpartum depression myth. African American women suffer in silence due to a fear that their child or children will be taken away. And this is how you reach me. I can stop sharing and let's just have a discussion. What are your thoughts? We went through some heavy material there. The statistics, and believe it or not, the UK parallels, the Black parallels our statistics for Black women. And it's very interesting to see who they have on it. when you,
Considering the two countries' history, it's not
yes,
surprising.
it's not surprising at all, but I mean, when we look at the statistics and they're going in the wrong direction, last year was a very hard year for maternal health.
I would imagine with
It
COVID.
was, I mean, not even COVID related. It was just the fact telehealth can't determine what someone's going through.
Right.
So the number of stillbirths due to a large, I mean, a vast number of causes that could have been prevented, you know, but you can't, if you're being told that if you're close to your due date and that's why you're in pain, you can't tell that on one of these things.
Yeah, exactly.
Yeah.
Uh,
Yeah. So the numbers, the mental health numbers, I sit on the board of PSI of Massachusetts, and looking at the emails coming in with requests for clinicians, for mental health clinicians, is I'm like, oh my God, everyone needs help. And there are not nearly enough clinicians to provide that help, not enough groups. People are asking for help, and there's simply not enough, you know. So we need to make more mommy and me groups, parent and me groups, grandparent and me groups, etc. Sibling groups to support the needs of our communities, just based on the fact that there are not enough clinicians.
and just thinking about, it's always been a thought of mine, like there's so much death that's not being processed.
Right.
So if you have a child that dies, the community response is very different than when you have an infant death or pregnancy loss.
Right.
Very different.
Right.
And so all that unprocessed grief definitely gets carried on to the next generation and gets carried on to the children in the family who are living.
Right.
Because nobody, there's no closure, there's no ceremony, there's no, generally people are like, oh, well, stop thinking about it. Right, completely unhelpful.
It's the at least comments get me. At least you know you can get pregnant. At least you know that, you know, and I'm like, some of the things that I'm hearing from the members of the PAIL community, I'm like, are you serious? Was that really said to you? You know, and I know it was, because
it's so stressful.
It really is. So what do you guys want to know? What do you
what are your suggestions around what should be said?
What should be said?
If someone experiences the loss of a baby before its first birthday or pregnancy, and those are different circumstances. So what do you suggest?
Well, my standpoint is a loss, because when we're getting ready to hit the heavy holidays, when you look across the table and realize the high chair is not there that would be there, everyone's suffering the same type of grief, regardless of whether or not they've lost due to a miscarriage, a stillbirth, SIDS, you know, chronic illness, what have you. So it needs to be discussed, you know, and we need to explain to our families, regardless of the outcome, they have had a baby and they need that postpartum care. Having the dumbest thing that was ever asked of me was, and I laughed because I really can't believe my response, was, did you have to give birth? And I said, well, Scotty was not here to beam her out of me. So, you know, of course, yes, I had a vaginal delivery, And she was beautiful, you know, and that's just my reality. But people don't understand that when you suffer the loss of an infant, it hits deep. And then people still don't understand that just because that child is not there, your body has no idea that there's no baby. All your body knows is that you were pregnant and then you're not. So that means you gave birth. You know, and trying to hold down a grieving person so that they can accept that postpartum care is really tough. But finding a way to make sure they get that postpartum care can shift the way they grieve.
Absolutely.
Meaning that can, it's not going to lessen the grief, but it helps to form that scab a little bit over the heart a little bit sooner, you know.
Sure.
And I tell people every time the scab falls off, it grows back stronger, and then it falls off again and grows back even stronger, and then it takes less and less for it to fall off, but it still does fall off, and then the next time it reforms, it will be stronger. Jesse Ray, I see your hand raised.
Thank you. I just wanted to first thank you for sharing your story and the vulnerability behind that. It's just really touching to hear that. And I was going to ask actually what you just answered a little bit, because I have had two cousins last year who both almost in tandem lost their babies. They were in the hospital. I'm not really sure of the details surrounding it, which is kind of sad to me, because my family knows that I work in birth. This is my dad's side of the family, but I guess my biggest concern is trying to get through. You know, I felt like I've had conversations with family members before about birth and stuff, but I feel like I don't always want to feel like I'm that person, you know, always talking about birth all the time, you know, at every family event. But then I hear about things like this with my cousins, and I'm like, well, maybe these conversations are getting through, or I don't know. I'm kind of stuck of how to really get through to them. I just feel like you talk to people know you're a birth worker, and they ask questions and stuff, but then they turn around and go to Kaiser. And not that there's anything wrong, you know, with going to Kaiser, but you know what I mean, where I'm going with that.
Mm-hmm.
You know, that's just and I don't want to be preachy. I don't want to sound preachy.
Yeah.
Especially when we're at, like, you know, a get together or something, and you know, yeah, I don't know.
Well, we have to normalize these conversations.
Thank
First
you.
and foremost, we have to stop allowing our elders to tell those lies about their postpartum period. We have to, case in point, that week between giving birth to Anaya and her memorial service, I was really going through it. You know, I was separated from my husband at the time, and we never got back together. And making arrangements, never having had to make these types of arrangements, and I was grieving, you know, hard. And one day my grandmother looked at me and said, "You need to stop acting like that." I didn't act like that when my son died. So I'm sitting there and I'm saying to myself, what is she talking about? And my aunt, who's my grandmother's youngest, just happened to be walking by at the same time and had to pick her bottom lip up off the floor because she's like, what is she talking about? Has she lost her mind? What's really going on here? And then, you know, our world shattered, because what we believed the dynamic to be, my mother being the oldest, and then my uncle, and then my aunt was the baby, that was the dynamic for their entire lives and my entire life, and so on and so forth. And she told us the story of Jeffrey, who was her firstborn, who died shortly, you know, a few months after birth due to cot death, which is now SIDS. So that opened up another conversation. She brought it up, and I just continued the conversation. and grabbed the family albums and started pointing at pictures of babies who I did not recognize as adults at our family reunions. And we had that conversation, even with that opened up a lot of different conversations, not just with my grandmother, but she was number 5 of 13 with a variety of my aunts and uncles over the years, cousins, etc., about their reproductive history. It's not just about the losses, it's about knowing that families on both sides reproductive history. Who's more likely to suffer a loss because of a legacy of loss? Who's more likely to have fibroids? Who's more likely to have endometriosis, etc.? So this is where I started. I started with grief and loss and ended up healing some of that generational trauma by facilitating these types of conversations, not just in my home, but in homes all over the US within my family. And then I took it to my trainings and started getting them to have these same conversations with their families. So don't feel like you're preaching. You're just breaking those curses. You're just getting to the meat and facilitating a healing process, not just for yourself, but for the lineage to come. So keep having those conversations. Be as preachy as you need to be to get what you need across to your family.
Thank you so much.
That's how we can heal that trauma that we all have. I mean, I love looking at how much this one little being who never took a breath beyond my body has healed my family's trauma, the lines, and created a new legacy for her siblings and her nieces and nephews to come, knock on wood. Tara.
Thank you.
You're welcome. Thank you.
So I'm a home birth midwife, and I'm particularly interested in preeclampsia. And I really appreciated what you shared about your own experience with it. And I've heard a lot in the last few years that, we need to be doing better with preeclampsia, especially with our Black mothers. And I'm just wondering, I feel personally the need to understand preeclampsia better. While I feel like I have an understanding of it, I think there's another version that I'm looking for, trying to understand and learn. And I'm wondering if you would be willing to share more thoughts on preeclampsia.
That's a tough one, because you can't pinpoint who is going to have preeclampsia and who isn't. I only had it once out of 4 pregnancies. And that one time, I had my blood pressure was low, always low. I was on a beta blocker for PVCs during that pregnancy. So the beta blocker was a blood pressure medication. So technically, my blood pressure should have been fine, but it just happened. And this is what I hear with everyone who has experienced preeclampsia. I had a niece with her little one of her daughters just turned 3, but this past June, she posted a picture of herself 20 weeks pregnant, 26 weeks. And I looked at her and I said to her, I automatically texted her because she looked fuller than she should have looked at 26 weeks. And then I thought back to her first pregnancy where she developed preeclampsia. And she got to 36, 37 weeks, and they had to medevac her to a facility that could, work with her. And then eventually, within hours of arriving, they delivered her. That child just turned 3 last weekend. Now, the picture of her pregnancy at 26 weeks with another little girl, I told her, run to your provider. You don't look healthy. Something's going on. How's your blood pressure? Well, auntie, you know my blood pressure is always high. Well, 2 weeks later, she went to see her provider. She wasn't feeling well. And it's a good thing she didn't listen to her knuckleheaded husband, because he told her just sit down and drink some water. This was Monday. And, you know, my stepsister, her mom, texted me, talk to Mika. She said, she'll listen to you, talk to Mika. I said, what's going on? She said, oh, I just don't feel well. I'm going to see my doctor. I said, well, keep me posted. I noticed that she posted on Facebook, it's all in God's hands now. Later on, after seeing the doctor, she was admitted. And they told her she had preeclampsia, which is what I could look and see, you know, a couple of weeks earlier. Now, it happened sooner this time, much sooner than it did the last time. She started, I said, tell me what they're saying. This was that Monday. And they started talking about her liver enzymes. I said, you don't have preeclampsia, you have HELLP syndrome. They're going to do one of two things. And I told her, and I said, don't be afraid, everything will be fine. Well, luckily, and I kept telling her her dates were off, and thank God for that, because her little one is coming home this week from the hospital after being in the NICU from June to now. And she's healthy and she's thriving and she's latching and everything. But that could have gone a completely different way had she not moved from Florida to Atlanta. I believe it would have gone a completely different way.
Say more about that, please.
What, HELLP syndrome, or
why the move from one to the other?
Well, when you're in a facility that specializes in African American care, they treat you a lot better. Case in point, in some instances, yes.
But
in some instances, I mean, we have, and I'm sure you're all familiar with Dr. Neil Shaw. He's being sued for racism right now. And the deposition that was publicized shows me that he should not be practicing right now, simply because he has said Black women are inferior. He has admitted using one of the teen clinic, the teen pregnancy clinic, as his sandbox to play in to find solutions for his white patients. And other things said in this long deposition that's just, why is he still practicing? And he's here in Massachusetts.
Is he a student of Dr. Sims?
Well, pretty much. And, you know, it's very disheartening, because I look at my last pregnancy with my youngest, and I often say, if I had gotten Dr. Laura Riley as my OBGYN the first pregnancy, I probably would have been back annually just for that treatment, because she was so wonderful. I went in, and I tell clients all the time, you can have it your way. I know that's Burger King's their slogan, but this is how birth should be. You should be able to have it your way. I went in to see her after I was just entering the second trimester. I had been in another place, and they kept calling me old because I was 40. And the young woman, who could have been a child of mine had I had her in my teens, just was very disrespectful. And the very last visit, I don't know when she realized I was gone, but she had her back to me and was calling me old, and I'd had enough. So I picked up my shoes, my purse, and my jacket and walked out, grabbed my cell phone because the only doctor who spoke to me after losing Anaya was a Black doctor who was a head of department at Massachusetts General Hospital, who said, this never should have happened to you. Your daughter was healthy and you were not. Had we treated you when you came in saying this, and that, because it was all in the file, and they said I was having a mental break.
Wow.
That's what they called it.
Wow.
So this goes back to listen to Black women.
Please.
This goes back to listen to your clients. This goes back to don't look at what problems they're having, because everything was attributed to the fact that I was separated from my then husband, and not looking at the fact that something was really going on with this pregnancy.
Mm-hmm.
And had I, for whatever reason, pushed everything off and assumed everything was fine, being so close, and as we know, because I wasn't comfortable with my OBGYN, I'm going to be perfectly honest with that pregnancy.
Right.
I only went in because I felt like something was wrong. And this is the same doctor that I had, she was as a resident with my first child.
Mm-hmm.
So my first child at that point was 10 years old. So 10 years later, she had it. You could look at her and tell she no longer cared. She had seen too much, she had done too much, and she needed to be someplace else.
Right.
You could really tell the difference between seeing her as a fresh-faced, happy-go-lucky resident and 10 years later as an experienced doctor who was just waiting to retire. So she didn't meet with me after my loss. I met with Dr. Laura Riley when I went back for my 6 to 8 week checkup. And that's when our relationship started. And when this teeny bopper during my rainbow pregnancy kept calling me old, every issue that I had was because I was old. Everything that I said that I wanted, no, we can't do that. And then finally I'd had it. She called me old one more time. And I said, if she calls me old one more time, I'm gonna pop her. So rather than pop her, I picked up my shoes, picked up my purse, and she was still talking. I don't know when she realized I was gone.
Oh, dear.
But I took out my phone and called, and Dr. Riley had added me to her list of possibilities because she said, if you ever get pregnant again, call my office. And I didn't listen because I didn't want to go back to that hospital. But I'll tell you, that was the best experience. And that showed me that I could have it my way, because I went in to see her when I entered my second trimester. And I said, I don't want any more vaginal exams. I want to choose my induction date. I want everything to be moved up at least a week. So since I was delivering at 37 weeks, everything was pushed up a few weeks. I want to start biophysical profiles at this week, and so on and so forth. It was my choice to be induced. And the perfect part, the perfect ending to all of this was when it was time for me to deliver, she walks in and catches my baby. She wasn't even on that night. And I said to her, I'm sitting there and I'm like, wait a minute, what are you doing here? She said, didn't you tell me you didn't want to be seen by anyone else? She listened. So every appointment, I told her the very first appointment that I don't want to be seen by any, you know how they switch you out and have you see, I don't want that. So if she couldn't see me, she called me herself, not a PA, not a secretary, even to the point when I needed to leave a day early from the hospital after having my daughter. She came in and discharged me herself. And then when I went for my 6 to 8 week checkup, she gave me my gynecological exam, simply because she said, this will make everything complete and you won't have to go back for another year.
There you go.
So you can't have it your way. So when you, what can you do? Look at, and I had this discussion with a group and they didn't like it. But the PAIL community has been using low dose aspirin to prevent miscarriage and preeclampsia, I think since the 70s. ACOG is just now acknowledging low dose aspirin as a way to prevent recurrent miscarriage and or preeclampsia in Black women, in women in general. And there's nothing wrong with that. I took it with my, and it's up to the person as to whether or not they use it. But knowing that this could be some way to keep you from, if you're more susceptible and if you're a Black woman, you are, regardless of pre-existing condition of hypertension, you do run the risk of getting preeclampsia. I don't know why. I believe it goes along with that whole generational trauma thing. And then the way that you're treated when you come in, the assumption that even if you're married, what was really funny about my situation was I was married, and she just didn't like my husband at the time. What did that have to do with the price of tea in China? My insurance was good. It was one of the best at the time. I was paying a lot for it, but I was still treated a certain way because, and it's in my file of what she thought of my then husband.
Wow.
Oh yeah. So they not only judge their patients, they judge the spouse. I've heard stories and all of that. You can tell. You can really tell. So what can you do to prevent preeclampsia? Teach your clients how to take their own blood pressure. That's key. Teach them how to dip their own first urine in the morning. That'll save you a lot of work. Explain if they're delivering in a hospital setting or if they have an OBGYN in a hospital setting. And I hate to have to say it, but I've heard people tell me that they did not have one urinalysis. They went to the hospital each time and not one time were they asked for their urine. But it's not enough to give the urine. You have to ask them for the results of the urine because healthy kidneys do not spill protein.
If I may interrupt and say, the cure for this situation, in my humble opinion, is midwifery care. You are a midwife.
Yes, yes.
So what you do, Tara, as a midwife and a home birth midwife yet, is the cure for this situation. Because no midwife visit goes like this.
No.
No visit with a home birth midwife would you not do urinalysis, talk to the client together over a cup of tea, prenatal visits lasting at over an hour. That kind of care brings up, oh, I had a fight with my husband, oh, I lost my job, oh, I didn't eat anything all day today, all those troubles. And again, in my opinion, although baby aspirin is a stopgap, good diet, healthy relationships, the vanquishment of racism.
There you go.
Is what is necessary to allow, because the numbers are clear. The browner you are, the more likely you are to die in childbirth in this country.
Yes.
What does that say? That's it. And those babies are not dying at home. No. So you, as a home birth midwife, I'm not even talking to you because they're not dying at home. They're dying in the hospital.
Right. Even if you transfer, for whatever reason, have to transfer, that's when the risk gets higher for that person. As soon as they enter the hospital, I know a home birth midwife, the pregnancy went according to plan. And one thing, something was off and she had to transfer. Each patient she transferred had a horrible experience because it wasn't the care that she had given at the home. And you're right. You can't get to know a person in 10 to 15 minutes. If you're rushing, half of the doctors come in and they don't look at you once. They're looking down at their computer and typing. I had a doctor, and that was the last time I saw her. Actually, asked me everything about everything under the sun and did not get to the reason I was in her office.
Wow.
And then she took her computer and ran, opened the door and literally ran down the hall. And you could see me chasing after her. I'm going after it. I'm like, why am I chasing down a doctor? She didn't even get to what I was here for. But this is the reality of medicine today. They have to fit a certain number in.
Right.
And if they can't get to the one, because not everyone's comfortable with talking about how their body is feeling. Let's start with kick counting, teaching that, making that routine. There's a whole city in, I think it's Utah, that cut their stillbirth rate just based on kick counting down, I think it's by 40%.
Mm.
And it continues to get lower the more people they can connect and teach how to kick count and what's normal and what's not. One reason I tell people to learn how to kick count is because, and to use Count the Kicks app, is because they can download that and take it to whoever their provider is. And it shows that the numbers are off. It's proof. So you are saying that something's not right, but you're showing with the kick counting chart that you can print off.
And
that,
see,
yeah.
I'm sorry, my sweet sister, I'm going to jump in there because this is all about patriarchy. A person coming in saying, well, maybe it doesn't feel right is not enough. You have to have like documentation. You have to have the kick count. I'm grateful for it. Don't get me wrong. If it gets them to move, that's great. But if the person just comes in and says, I didn't feel my baby, that's not enough. And that pisses me off. I just had to say that. That just pisses me off.
And see, one thing that pisses me off is hearing providers say when they get to the end of the pregnancy, that the baby doesn't move as much because they don't have enough room to move in. The reality is babies have no concept of room. So they're going to continue. That's the only place they've ever known.
My
So
children were kicking my heart out of my chest.
Oh yeah. Push-ups. I mean, handstands. That's what I used to call them. The legs, you could see my rib cage and my breasts going with the legs going up and down. And that's perfectly normal. But for them to say that they're running out of room, are you kidding me? And well, it's not enough to ask if the baby moved, because if you put a carrot in water and let it sit, eventually it'll float, and then you move the glass and it'll simulate movement every time anything in fluid moves. So it's not enough to ask, is the baby moving?
No.
I've talked some providers into saying, okay, may I see your kick counting chart? That way they can assess how much this little person is moving, and if
I love that there's an app. I never knew about that. What's it called?
Count the Kicks. There are several apps.
I'm gonna get it right now.
There are several apps, but the Count the Kicks app is the one that I know has this. You can send the kick to the grandparents so they can see. You can download and have this running thing. So every time you see the doctor, say, put this in my chart. And that's when things start to look a little wonky or go off a little bit. That's when, everybody can get involved, because the numbers are there. The baby was kicking this much for 3 weeks or 6 weeks or however many months. And then when they got to this point, it started to slow down. So something's wrong. Let's get them in here for a non-stress test and see what's going on. Let's do a biophysical profile. Let's see what's going on, because that can determine whether there's a cord accident or what have you. We need to start measuring these umbilical cords to predetermine which babies. I mean, I feel so bad for Dr. Jason Collins. He's been screaming from the mountaintops for years to measure the umbilical cord to determine which babies are at risk for a cord accident. And no one, ACOG won't add that.
Well, as important as all of what you've said truly is, very important, we got to take a look at the fact who has access to the 100 grams of minimum of protein that you need to be eating every day to grow a healthy pregnancy.
True.
Vegetables, fresh
Right.
water,
Right.
you know, who's not standing on their feet all day at Walmart,
Mm. True.
you know, and can only run to the candy machine to grab a quick bite to eat to get back to work. And then you're pregnant, you know, the folks who are in abusive relationships, you know, racism and low income and all these things affect people emotionally and spiritually and psychologically, you know. And sometimes I think that there are people who are just trying, there's a way in which people are trying to commit suicide passively because something just shuts off about taking care of themselves and just taking care of their babies. And where's the emotional help? And rather than blaming and shaming people, where's the help for them?
Well, that goes back to the fact that we need the village. There's a woman in Australia, and I'll have to share that link with you so you can pass it on to everyone,
Please.
who turned her her neighborhood, her street, into a community. And the way she did that was, you know, she went door to door and introduced herself with her clipboard and told them all what she was trying to do. And they were like, okay. And the whole street, now this was the first street. After seeing this, I saw her TED Talk recently. It was from 2014 though. And I was so moved by what happened that I had to email her only to find out that she moved. And then I got really upset.
Oh.
But wait a minute. She moved to another street, and instead of 20 houses, there are 350 houses that are a part of this community-led process where the backyards have no fences. And some of the yards are dedicated to composting, some are dedicated to chickens, others are dedicated to gardening, and everyone in that 350 house family they get the stuff delivered. If your sink has a leak, someone on the list can come fix it because they're in your community, and all you have to do is buy the whatever the materials. This is where we need to be. We need to stop looking at the I of in community and think about adding a we somewhere. We need community. We as humans have gotten away from our nature.
Definitely.
And
Definitely.
it's time, and it shows. You know, I thought about that. I said, wow, I would love to live in a community like that. And at one point in her presentation, she says, when you have community, you don't need insurance.
Exactly. And that is how African Americans used to roll. And
Right.
that is how we survived being enslaved people.
Mm-hmm.
Because there we were, slaves, we knew that a sister slave was expecting people would give up little bits of whatever they were going to eat
That's
to
right.
her. And we had midwives who gave a darn about us. We had our pre-grand midwives, but the enslaved midwives who made sure would go around and collect food for the pregnant woman in that community. And they were so good that the white women wanted to have those midwives deliver their babies.
Oh, of course. And see, this is the thing. This is only in Western cultured. We only experience this in Western cultured countries.
Yep.
When you go to a non-Western cultured country, you see it, right? I was on the phone with a woman from South Africa this morning, and we're talking, you know, going back and forth about customs and community. And I'm like, okay, I'm ready to go. I'm really ready to go. Simply because we need to get back into community in order to save our people, to save our community, save our women. You know, it's a real sad reality. So, okay, other questions. I can go on and on. As you can see, I can talk.
No, it's good stuff. Anybody else have any questions?
But I think we could shift the paradigm by building community. And that would take care of the food crisis.
Because so many of our crises, because
Yeah,
we are dependent upon a government that's not very responsive to our needs as a people, and that's any
right,
people, no matter what color you are. It just happens to
right,
be worse for Black folk. And we don't need a government per se when we're actually a functioning a tribe.
right, right.
Human beings on the planet are living the best, those who live in tribes. And the tribe is a family group, a series of family groups that take care of each other.
Right. But
Yeah.
see, I used to listen to my grandmother tell me stories about when the babies were born and how the women in the community is they had a farm and neighboring farms, and they'd come, and the men would be outside killing a hog and cooking the hog over a fire outside, while the women were inside doing whatever needed to be done for this woman and her children. And I said, I bet you nobody was in there telling her she needed to get up out of the bed,
Right.
an hour after she delivered.
If they were like my grandmother, they would sort of spanked her in the butt and made her go back into the bed.
Well, see, that's it. And that was the norm. They took care of each other. No one ever went hungry.
Right.
And it was a whole community event. A baby was a time to celebrate, regardless of the
Absolutely.
outcome. We need to get back into being able to celebrate these new people coming in. We need to get back into providing the support. I think if we were to build communities, we see less death.
On so many levels.
Mhm. I
On
mean,
so many levels.
looking at the number of people who killed their children last year due to the babies, due to postpartum depression. And one thing that really bothered me in each case, there was a neighbor who said, well, I knew she was suffering.
We heard something, right?
Or a family member, oh yeah, we knew she had postpartum depression, but what were we supposed to do? If she lived, instead of taking her to prison, they should be going right along with her. In the instance of the twins that the mother killed last year in New York City,
Yes.
the neighbors and the family should have been taken away with her to prison
I agree.
because they knew. How are you going to watch someone suffer and not do something? And I often compare having a new baby to when the military captures someone and they use sleep deprivation and noise to break them. It's the same thing when you bring a new, I know you're laughing, but you know I'm telling the truth.
No, I totally know you're telling the truth.
It's the same thing when you bring a new little person home. There's no way you can go constantly for 24 hours a day for everybody, including that new little person, and not develop a postpartum depression or psychosis.
Word.
There's no way, no way whatsoever. And then think about the anguish if there's a lack of crying because the baby's deceased. You have the same thing with the anxiety, the postpartum depression, and the PTSD. So we have to do better by our people. I know there are a lot of elders. I've been doing presentations in churches telling them, if you take care of your congregation. Every old person loves a baby. It's something that helps their life, helps them live a little bit longer,
Absolutely.
and it gives them a light. If they're not willing to go into the homes because of the pandemic, have them bring the babies to the church. The churches are still vacant up here. I don't know about where you are. So that's the safest place to be. Have them come in. The older people have been just sitting in wherever because they're not out and about because they're afraid of catching the virus. And these new little people need someone to watch them. Bring them there, have an area for the moms or the birthing people to get some sleep. And it's a win-win.
We're creative people. We can figure out ways.
That's right.
Do
But
it.
sleep, I remember that was the worst. You know, but with my youngest, that was the only one I really took care of myself with because I knew better. And plus I had her at 41. So I knew that if I
We've
did
learned
not,
some things.
oh yes. You know, I taught my children, my older two, to be my postpartum doulas.
Outstanding.
Mm-hmm.
Outstanding.
And yeah.
And that's the
So
whole thing. I mean, of course, people have concerns about folks who are abusive, and that's understandable. And the thought that the baby in the community is all of our babies is what
that's
kept
right.
us all alive.
That's right.
But yes, we are, we're wary of folks who have been hurt and so can hurt.
Mm-hmm.
Because people who didn't get all that love when they're babies are the people who grow up and cause a lot of harm.
That's right.
So let's break the cycle by loving up the babies now, meeting their
Yes.
physical and psychological needs. And a stressed out, unhappy, lonely, aching mama,
Mm-hmm.
what is being transmitted to that poor child? It's not the mother's fault. It's not the baby's fault.
No. I set up my May client. I had it worked out so well. Her mother was coming to stay with her for, a few weeks, and her sisters would bring food when the mother had to run out and stay and take care of her, and the husband was staying home from work
Nice.
for a few weeks and all this so that she could rest, and only the baby was only to be brought to her. We planned this. So a couple weeks went by postpartum. I called to check in. How are you? Oh, I'm okay. I'm doing okay. Her voice was a little off. Where's the baby? Oh, she's sleeping. Why are you on the phone with me?
Why aren't you sleeping?
A couple more weeks went by. Called to check on her. How you doing? Oh, I'm tired. What are you doing tired? Where's your mother? I couldn't take it anymore. I sent her home. Where's your husband? Oh, I sent him home after we were home 2 weeks. He was getting on my nerves. Where are your sisters? Oh, we had a falling out. I mean, it was perfect. We had a laundry schedule.
Oh, dear.
We had everything. And it flew out the window because she just wanted to be alone with her baby. She couldn't understand why her mother wanted her to be in the bed, because that's what we talked about. But I'm not
Right.
sick. She'd had a C-section.
Oh, no.
Oh, yes. Then I had my June client who listened, whose parents listened. She's a minister's child. And for the first 2 months at least, she did nothing, because that's what I told her job was, to do nothing. You can come downstairs and lay downstairs on the couch. You can stay upstairs in your room. But when the baby is to only be fed by you and cuddled and snuggled with whenever. But as far as you changing, doing laundry, cooking your meals, no. And she listened. First time mom, I was so proud.
Good for her.
But it's rare to have these clients.
And it's like it is a self-esteem issue, because
Right.
especially Black women, we have survived by being hella industrious.
Mm-hmm.
I mean, we can literally move mountains, and we do on a daily basis, and it kills us doing it, right? And so to then like lay down, And that's why the issue of mortality is really hard for college educated women who are the most
Right.
busiest, productive, dealing with corporate America or academic America or wherever they are. They have to be the best, the sharpest all the time. And they do it at cost to their central nervous system, but they do it. And then they have a baby and they're all falling apart, preeclampsia and everything else.
Right, right. And see, people don't understand that postpartum preeclampsia is real.
Yes, indeed.
There's a woman who is in the maternal health field, and she had a baby in June. And we reconnected. I do a lactation support group on Mondays from 2 to 4, virtual. She drove herself to the hospital that was close to her, which was not friendly for Black women. She went to the ER, and she had to take herself because someone had to stay at home with the baby. We are still going through COVID. At a certain point, she said she knew that she would die if she stayed at that hospital because they were not doing anything for her. They hadn't even, and she, like I said, she worked in the maternal health field. So she knew what was happening.
Right.
And she was experiencing this. And when she was telling me this after the fact, I said to her, all of the power players here in Massachusetts, and they're all in your text, in your phone. So why didn't you text someone?
Right.
She said, when you're in the moment, you don't think about that. This woman got in her car and took a 45-minute drive to get to a hospital that would listen.
Bless her
Now,
heart.
she could have died or crashed or whatever on the way. They kept her for almost a week at that other hospital once she got there. But she felt that if she did not do that, she would never get back home to her baby.
Bless
And
her
that's
heart.
what she said. She said, I had to get back home to my son.
Bless
And seeing how they were treating her. Well, you're married, but where's your husband? Well, he's at home with the baby. Someone had to stay at home with the baby. When can we be served without fear and judgment?
It would be, under toxic, racist patriarchy, Black women aren't supposed to have babies anyway. We're not supposed to be here anyway. So it's
we didn't bring ourselves here.
Thank
This
you.
is what I have to explain to people.
Thank you.
We were literally plucked,
dragged out of business.
Exactly. And yet this whole, there's so much. There are new bills
disgusting.
that are being introduced in DC. That'll never pass because they're to benefit women in general, but more so for Black women. A bill that needs to be on your radar is the pregnancy loss bill that was recently introduced.
Do you have the bill number? Would you have to?
I don't have it, but I can get it. I was in a meeting with my congresswoman and some other people about a month ago or the beginning of this month. This month seemed to drag on. I don't know why, but yeah, it did for me. But that's one bill that would make sure that people got paid time off after a loss. And one thing that I'm noticing, sort of working on the state level and working on the federal level with bills, is that the state level is pointless. If you want anything done, you need a federal bill that will be an umbrella for all states. Because as soon as that bill passes, there's an office that generates the law and the document that says this is the law, and it goes out to every HR office in the country. And that's what we need. We need to spend more time focusing on maternal health bills on the federal level, because the state level, it's too much. There's still too many old white men running the show. And it just amazes me, like last year when they were talking about that abortion bill. And one of the legislators, the one that was messed up in Texas.
Mhm.
One of the legislators had just given his girlfriend money for an abortion, his mistress.
What?
Yes, he had just given, and when this came out, I'm like, wait a minute, what? He had just given his mistress money to get an abortion. And then he voted no on the abortion.
He
So
also
I'm
want
and
anybody
it
else's
came
girlfriend
out.
to have an abortion.
It came out that he didn't want his wife to know he had a girlfriend.
Ah,
But it all
ah.
came out because the girl was like, wait, what? You know, but this is our reality. They're hypocrites.
Yes.
And we never should have allowed men to have governance over our bodies. Never, I don't know how it happened. I don't know why it
Oh, the
happened.
series of
We
tragic
gave
errors,
them life.
and there's no respect for that.
Zero, exactly.
There's no
It's that,
respect for
I mean,
that fact
seriously.
whatsoever.
Well, you know what?
Okay,
We need to take it back.
We need
Yes,
to have
yes.
you come back because
Yes,
I'm
we
I,
are
I'm just,
almost, we're at my time.
yes, but you know, where you're speaking to a group of doulas, so a few words on how doulas can be supportive to a family who's experienced a loss of a baby in the body, a child outside of the body. How can doulas be helpful?
Can be helpful by showing up, completely showing up, meaning empty your mind of the laundry that you have to do later on, or the child that needs to be taken to their violin lesson, and fully engage with the family that you're serving. If you can't do it physically, these things, these phones are wonderful support systems. Before you get out of bed in the morning, you can text every one of your lost families a word saying, I'm with you. That connection can save a life.
Totally.
I've lost a lot of moms to suicide after they've suffered their losses. Being a member, having a foot in the pregnancy and infant loss community as a member, it's very challenging, because we never look at what's going to happen when these people get home. So supporting a person who suffered a loss, give them, if it's a if they're giving birth, give them the best birth ever, because they can have the best birth in spite of what the outcome is.
Absolutely.
The absolute best birth.
Absolutely.
And they can say, I have a client who always says, we had the most beautiful birth in spite of the fact that my child was born still. Let them remember that beautiful birth.
Exactly right.
And if you have the ability to get them before they deliver, you can give them all the power. This is their birth. This is their baby. Because I guarantee if it happens in a hospital, as soon as they get there, out of sight, out of mind. So that means it's going to be like a speed through type of situation, because they want to rush the family out of there. Because no one wants to deal with a deceased baby or the emotions that come up when someone dies, especially a baby. There's nothing natural about infant loss. Nothing natural about loss at all. So just remember, slow things down when you're working with the families. Even though the medical establishment wants things to run really fast, just slow it down. Ask them, is this what you want? I know you may not, you don't have to make all of the decisions right now, because it seems like they have to, but they don't. And most importantly, they do not have to abandon their child. If the baby has a fatal diagnosis, they don't have to abandon. And if they don't have the money for a funeral, there are funds out there that can help. so they do not have to walk out of the hospital and never look back at their child's body. They can give that baby the burial or the cremation. And you know, because a lot of families think death and think that they're going to have to put out a lot of money.
Thank you so much. And I'd love to add that for clients who have a spiritual home, a church home,
That's right.
I'm born and raised Catholic. There's whole rigmarole around the death of a baby in the body, or a stillbirth, or a child. There's whole religious rigmarole, which is very healing for a person who's connected with that community. So, you know, to have the client reach out to if they are connected with a church family, to reach out to that church family to see how that is processed in that community, because there can definitely be tremendous healing, just being recognized as a bereaved parent and walk through whatever the community spiritual beliefs around a little
Sure
one
she's
who's
okay.
passed, or a baby who's not born, who's born but not born alive.
And I forgot I have to do my giveaway.
Yeah, do that.
Let's see. So number two is, oops, you can't see it. Well, it might be backwards, but it's a
Who
two.
was number two? That was
Number
Jessie.
2 is Jessie Ray.
Oh, Jessie Ray.
So find me on Let's Connect. I'm gonna send you my email address in the chat,
Thank you so much.
and you'll have to let me know if you want the live course or the self-paced course. My next live training is October 9th and 10th. And then you can, the other one's on Teachable, and I can just add you.
Sounds good. Thank you so much. Yay.
So, dear sweet friend, one day I will look forward to sitting at a table with you and having a cup of tea.
Yes.
Now, I'm really glad that we've graduated from Facebook to at least now, here we are in Zoom.
Yes.
This is an elevation of our friendship.
Yes. It's gonna happen. I was in Oakland in 2019.
Oh, come back.
I'm gonna come back. One of my friends just moved from Virginia to Oakland, so I'm gonna connect you to. She's great. She worked for Health Resources in Action,
Oh, that's great.
HRIA, and she left them and is now back in school.
Good for her. What's she
So,
studying?
I have no idea, but she's yet another maternal health advocate that we have lost this year, who will not do this work anymore.
It's so daunting. It's
too much.
It takes a lot of just inner strength. I know, as being a doula, similarly, it's like, oh my God. So definitely connect us. And we will stay connected, because I love everything you post, and you're very sweet to everything I post. So we are very good Facebook friends.
Yes, ma'am. Definitely. Well, I'm gonna hop off.
Let's have a minute. We're gonna do a moment of silence for your babies, and then we're gonna hop you off, unless you got to run to your child.
Oh, no. I think she's asleep. She's quiet.
Uh-oh, nothing burning. That could be dangerous.
Oh, I know.
Raised 5, girl. When my house got quiet is when my heart started to pound. So.
Well, it's late and she gets up early, so
she nodded off. I'm
hoping, and she's with her big sister. My boy is right here. I'm in his room hiding. I don't know what they think goes on in here, but it's like, this is my safe space. I can come in here and they're like, she's in Bubba's room. What up? Oh, and then they'll at least knock.
That's good.
Yes. Bless
their sweethearts. My people are all grown up. I miss the chaos. I never thought I would say that, but I say it every day.
Well, when I come to Oakland, I will bring my youngest with me, probably the other two also, if they can get off from whatever they're doing. And you'll probably tell me, like everyone says, she's a lot of work. Do not come back.
Oh no.
Oh yeah,
I
people have told me do not. I mean, she doesn't move. It's just she asks a lot of questions.
she's loquacious. Good for her.
She's a September Virgo. What else can I?
Answer the child's questions. It's all right. We can do
It really
that.
is.
I'm
It
so
really is.
starving for the energy of little children that I will not care. I promise you. I will not care. So I'm going to light a candle. Let's have a moment of silence for all of our little ones who were lost and all of the ways that little ones are lost to us. And we will hold them in our hearts according to our beliefs around that. Wherever we know from our ancestors that they are, we pray that they are happy, that they know that they are loved, that there are folks who miss them. And according to our belief systems, we look forward to seeing them again one day. And so let's all take a nice deep breath together, especially if we're remembering a young one. Want to hold that little one close in our laps and give it a kiss on its sweet little head and send it on its way. And say our hearts are always open. You can always come back. We love you. And for the little ones who died without someone to love them, know that we love you. And pray that we may be a village worthy of all of our children. Blessed be, amen, so be it. So thank you, Nneka. Love you. Keep fighting the good fight. Let me know how I can help. I want us to do something together. Let's talk about doing something.
That would be wonderful.
I'm all about it.
Can I tell you a quick story?
Sure you can.
My grandmother passed on February 20th.
I'm sorry.
And she was here at home with us. We loved on her as much as possible and took care of her.
Oh, so nice.
The next day, I called a friend of mine who became a friend of mine because my angel baby harassed her.
Huh?
And yes, she woke up. We met in 2015, December 2015. She called me and she said, she didn't call me. She kept posting on my inbox in one of my groups. This is, please, your child keeps showing up on my phone. And I'm thinking it's my oldest daughter. And I'm like, why you keep bothering this woman? She was from Missouri.
Mm.
And she said that she'd wake up every morning and Anaya's picture was on her phone.
Wow.
So that's how I met this woman. It was a weird story. One of her friends actually kept saying, she's telling the truth. I've seen it happen. We've been out and your daughter's picture will pop up on her phone.
Wow.
Fast forward to this past February 20th, which was a Saturday, my grandmother passed. On that Sunday, I called my friend because I knew that she was connected to spirits. Now, I never believed any of this stuff in my life, okay? I was very skeptical about mediums and so on and so forth. And she said to me, your grandmother passed. As soon as she answered the phone, she said, I am so sorry. And I'm like, how do you know? She said, well, she's standing right here with your daughter. And I'm like, oh my God, what in the world? I'm so sorry. She said, no, she just wants you to know that she's okay and that she will always be with you and she loved you so. But now Anaya has her person. That's what she wants, she's told me. So it was a very funny story for me, and how, you were saying for babies to love. And if someone had said that to me before 2015, I would have told them to kick rocks. But because this white woman from Missouri and some of her friends stalked me on Facebook for weeks, I had to believe her. And she knew stuff
Yeah.
that only Anaya would know from being inside me.
And, you know, what's essential is invisible to the eye.
That's right.
You know, the world we live in is so much more than what we can see, touch, smell, and taste. And that belief keeps me living. I swear
It's
to God.
amazing. We're amazing people. We're amazing beings,
We are.
you know, and when we open ourselves up to it, we learn so much. On that note, I can talk, so let me go. Let me see where I did receive your email, Jessie Ray. So I'm gonna respond in a little bit, and then I'm going to bed. So thank you for having me.
Thank you. Sleep well, my
And
friend.
have a good night.
Good night.
Thank you, Nneka.
Thank
Take
you.
care,
Good night.
everyone. Good
Good
night.
night.
So lovely people. We're going to close. September soon will be the end of Infant Mortality Awareness Month, and October is National Pregnancy and Infant Loss Awareness Month. And this was our observance of both. So thank you for being here tonight, and I'll see all your beautiful faces next week.
Good night.
Good night.